I am Charmonique Jackson, and I'll be presenting on prostate cancer. And this will be for Dr. Milesk's Structure and Function of the Human Body course. Okay? Okay, so prostate cancer, we'll start with what is the prostate. So the prostate is a gland found only in males. It sits right below the urinary bladder, but in front of the rectum. The prostate size changes with age. The prostate usually stays about the same size or grows very slowly. As long as males have hormones present, the prostate will grow. In younger men, it is about walnut size, but can be much larger in older men. As for its job, the prostate makes some of the fluids that protect and nourishes the sperm cells and semen. It also makes it more liquid. Alright, so several types of cells are found in the prostate, but most prostate cancers develop from the gland cell. Most prostate cancers start in the epithelial of the glandular tissue. This kind of cancer arising in the glandular is known as adenocarcinoma. It mostly originates in the peripheral zone of the prostate. On a basic level, prostate cancer is caused by changes in the DNA of the prostate cell. Certain changes in DNA can make normal prostate cells grow abnormally and form cancers. So although some think prostate cancer is inherited, the development of prostate cancer may be linked to increased levels of certain hormones. So high levels of hormones such as testosterone in the male can promote prostate cell growth and might contribute to prostate cancer in some men. Okay, so areas of the body that can be affected by prostate cancer. Chronic or recurrent inflammation of the prostate, known as prostatitis, is thought to play a role in the development of prostate cancer. So areas of the chronic inflammation can result in atrophic lesions called proliferative inflammatory atrophy, which is PIA. And in PIA, which contains proliferating epithelial cells, PIA is often found next to prostate cancer and is therefore believed to be a precursor of it. So continuous growth of the prostate tumor eventually causes it to extend through the prostate capsule and invade nearby organs such as semivesicles, the bladder, or even the rectum. So further invasion of blood or lymph vessels also allows the cancer to spread to distant organs, mainly bones, viscera, and lymph nodes. And in bone is most the common site for metastatic disease and prostate cancer. So with the male prostate being located within the male reproductive system and located inferior to the male urinary bladder and the pelvic cavity, problems within the prostate can definitely affect both of those symptoms in males. So with age and sometimes inflammation of the prostate, it gets bigger and can block the urethra or the bladder, causing trouble urinating or even sexual problems. This condition is called BPH, which is benign prostatic hyperplasia. Although this condition is not cancer, surgery may be needed. Okay, and here we have a image of the male reproductive and urinary system. And both consist of a few things here. We have the vertebral column here, the male rectum, the semivesicles here, the anus, the epididymis, the male testes, which is right above the male scrotum. We have the ureter, the male urinary bladder, which is here right above the pubic bone. We have the male prostate, which sits right behind the bladder here, the erectile tissue, the male penis, the urethra, and the glans penis. Okay, so now we have symptoms of prostate cancer. Okay, so in prostate cancer, and with the symptoms, it's thought to be most found in older men. So testing and routine screenings are most of the time not a big concern in younger men. But early prostate cancer usually causes no symptoms and not everyone also experiences symptoms. So many times, signs of prostate cancer are detected by a doctor during a routine checkup. So some men will, however, experience symptoms and changes like the need to urinate more frequently, especially at night, difficulty starting urination, weak or interrupted flow of urination, pain or burning during urination, difficulty having an erection, pain with ejaculation, blood seen in urine or semen, or frequent pain and stiffness in the lower back, hips, and upper thighs. With these symptoms, it can also be an indicator for other diseases or disorders such as BPH or prostatitis. It is best to consult your doctor if you experience any of these symptoms so a workup can be determined.
Right.
BPH, which is benign prostatic hyperplasia, is an enlargement of the prostate. So BPH is not prostate cancer, and having BPH doesn't make a man more or less likely to get prostate cancer. So by itself, with just an enlarged prostate, it most of the time causes no symptoms and sometimes does no harm. But as for prostatitis, which is inflammation of the prostate, this painful condition, which is an inflamed, swollen, and tender prostate, can be caused by a bacterial infection or other factors. Okay, so here we have an image of a male prostate, the male bladder right above the male prostate, and there it shows if there was a possible cancer. So there it shows prostate cancer. Okay, so we're going to go on prostate cancer treatments. So there are several types of prostate cancer treatment. There's the option of surgery, chemotherapy, radiation therapy, and also innovative targeted treatments such as hormone therapy or biological therapy. So in certain situations, physicians will recommend an active surveillance approach before beginning any treatment. In this situation, a person's conditions will carefully be monitored, but treatment will be delayed until the cancer starts to cause any symptoms or spread. Sometimes this may even take years to occur. Okay, so prostate cancer treatments. So typically there's no one-size-fits-all treatment for prostate cancer. The process for deciding what treatment will be best is considered by a combination of things and factors, which depends on the male, therapy, the level of risk, and also personal circumstances. Okay, so first we have surgical. So men have surgery as an option. So a surgical approach to treating prostate cancer will remove all or part of the prostate. So typically men with early stage disease, prostate cancer, or cancer confined to the prostate will undergo radical prostatectomy, which is the removal of the prostate gland and some of the surrounding tissue. Okay, so next we have radiation. So also there's radiation therapy. Radiation involves the killing of cancer cells in the surrounding tissue with the direct radioactive exposure. Some of the forms of radiation therapy can also be used in men with more advanced or recurrent prostate cancer. So the external beam radiation therapy is the most common type of radiation therapy. And also CT scans and MRIs are used to map up the location of the tumor cell in prostate cancer, and it's used to target those particular areas.
Right.
Okay, chemotherapy. The term chemotherapy refers to any type of therapy that uses chemicals to kill or halt the growth of cancer cells. It works in a variety of ways, but it's based on a simple concept. Stop the cell from dividing, and you stop the growth and spread of the tumor. Okay, in conclusion, in doing my project here on prostate cancer, I've been able to use the information I gathered to relay over to my father, who's been recently diagnosed with prostate cancer. So the information I gather, I'm able to inform him on the signs, symptoms, and the treatments available for him in prostate cancer. Thank you.